we are very, very happy to welcome Megha, also known as Dr. S. She is a resident at Mount Sinai. She can tell you a little bit more about herself, but she's going to be with us for these community conversations, and we are really, really delighted to have her as an expert on all things related to flu, RSV, and COVID.
So I wanted to go through just a little bit of an overview of respiratory illnesses. And first and foremost, my name is Dr. Shrivastava or Megha. I'm a resident at Mount Sinai. I've done family medicine training prior to this at Columbia. I'll likely be doing an addiction medicine fellowship after this for a year. So I have about a year and a half left at this current preventive medicine residency at Mount Sinai. We get a master's in public health and we do a lot of health equity work and prevention work. That's really our focus. Today, like I said, overview, we'll go through vaccines just a little bit and then some resources. This is just a little general overview of just the anatomy of what our lungs look like. We're focusing on talking about respiratory illnesses, COVID, flu, all of that. It's kind of important to just understand that there's certain illnesses that kind of don't go past your trachea or just stay in your trachea. And that's your throat basically. And then there's some that go down into your lungs and the lungs get complicated. So once you go down there, but just so you get a sense that it's kind of like a little tree, and the lungs, things get further down into the alveoli, which is like where your lungs exchange your air into your blood and get oxygen to your blood. So some illnesses, some viruses affect different parts of your lungs, which is why you kind of see different symptoms, even though there are a lot of overlap of like having a cough or having fever. These are just like things that happen because those viruses, those like inflammation from asthma, all these things kind of affect different parts of your respiratory system. So some of the big ones: COVID, pneumonia, RSV, influenza, asthma is a big one. COPD, bronchitis is also another one. So I'm going to talk a little bit about some of the vaccines, just a general overview, because I'm sure a lot of people are itching to just like know what you need and then like where to get it. So I kind of wanted to start out with that. A lot of these illnesses have kind of different in terms of the virus. Asthma and COPD aren't caused by viruses, but a lot of these kind of like are interlocked in some way. So asthma and COPD put you at risk for respiratory illnesses because your lungs are a little weaker. COVID and RSV, those are viruses. Influenza is a virus. Pneumonia is actually caused by bacteria. There's also common colds. This has a whole list of different things, but rhinoviruses, like other coronaviruses that are not COVID, those cause common colds. So that can also affect your lungs too. But the big ones that we're going to talk about that we want vaccines for that like are actually can escalate to very serious disease are really like COVID and flu and RSV. We'll focus a little bit more on that, but these are all viruses. These are all different things that can affect your lungs. So vaccines, if you're between 19 and 65 years old, if you don't have any risk factors, you want to get your COVID vaccine, your flu vaccine. HPV recently, that is for like preventing cervical cancer. It's a virus that can cause cervical cancer. You can actually get it up until the age of 45. So if you've never gotten it or you're not sure, you want to talk to your doctor about it. And tetanus for everyone, you want to get it every 10 years. I know these are a lot of vaccines, a lot of things. I'm kind of giving you just what you kind of need. Shingles is also very painful and definitely something you should get if you're over 50, and then you get it earlier than 50 if you are immunocompromised. And then in general, if you do smoke cigarettes, if you have alcohol use disorder, HIV, diabetes, there's a few other diseases that qualify as well for the pneumonia vaccine. So the pneumonia vaccine is also something to talk about with your doctor if this applies to you at all. But most people don't qualify for the pneumonia vaccine until they're over 60. So for people over 60 years old, these are the main vaccines that you get. So this isn't including some of like the ones you were supposed to get as a kid. And if you're unsure if what you got as a kid, that's okay. When you see a doctor, they'll test for kind of what your immunity is like to these things. So these are the main ones for if you're over 60: COVID, flu. Flu is yearly. We'll talk a little bit about flu because I know that people have very mixed feelings about flu and COVID and getting those vaccines, but I'm just kind of giving you what the general recommendations are right now. RSV is a newer vaccine that is for the respiratory syncytial virus, which is another virus that causes a lot of problems, especially in children, and children like automatically, they also get it, but also for elderly. So really, if you're over 60, it's something that you should talk about with your doctor. And then if you're pregnant, COVID and flu and Tdap, I said, but that's the tetanus shot. Hep B is another one if you never got it before. RSV is something to give immunity to your baby. So you get it later on into your pregnancy, and then you as a mom get it, and then your baby will be immune. Or if you don't get it, then your baby needs to get it within the first few months of their life. For pregnancy, you don't do shingles or the measles shot or the chickenpox shot until after delivery, because those are like live vaccines. So there's two different types of shots for the pneumonia shot. If you're like a healthy 60-year-old, the series that you'll get will be different compared to like if you're immunocompromised or if you're younger and you qualify for the shot. Typically 2 shots that are like 8 weeks apart, but that kind of varies. These are some free clinics. So everybody should have a primary care doctor, whether you're uninsured, insured, Medicaid, Medicare, everyone should have a primary care doctor of some sort. A lot of health issues are so hard to navigate, and your primary care doctor will be helpful for that. And if you don't like the one you currently have, don't feel comfortable with them, then you got to change it too, because it's so important that you guys have someone that you trust in the healthcare system to help you through things. So these are some resources for clinics that FQHC, so that's a big word, but that is basically the government having effort to provide healthcare to every single person and get people covered. They have these specific clinics that are essentially free clinics. Sometimes it is like a sliding scale. So I think it's worth, if you don't have a primary care doctor, to call around these places and find out. And I know these are really hard. And I know the Health Action Center also can really help you kind of navigate some of this too. Finding some sort of person to guide you through things. These are some places to call or to show up to, and kind of a lot of places won't necessarily take walk-ins right away, but you can walk in and at least try to get your name there so they can reach out to you or like set up a meeting so that you can talk about if you're uninsured, if you have Medicaid, like how do you get to see your doctor? They should be able to assist you with that. This is from the Health Action Center, so on 115th and Lex, but getting connected with insurance enrollment counselors that are available Tuesdays and Wednesdays from 11 to 3 p.m. You could call them and during those times to discuss how to get insurance, to get low or no cost insurance, and their counseling is available in multiple languages. And then just generally things you should have at home. Face masks and N95s, especially if you have any sort of comorbidity is what we call it. So any other like illness or like diabetes, hypertension, obesity, you should be wearing some sort of protection because you are at increased risk for respiratory illnesses. COVID rapid tests. Smart University actually gives out free ones every Wednesday and Saturday mornings by the Health Action Center. So there's there. And then you can also show up to the Health Action Center and they have rapid tests. Go to nyc.gov as well. I think there are times where they send you things as well. They'll send you rapid tests for free. So having that just in case, and hand sanitizer, soap that has antibacterial in it. If you have asthma, you obviously should have an inhaler. If you've been diagnosed with asthma, if you're not needing an inhaler in general recently, that's great. Hypertension, you should be able to monitor with a blood pressure cuff. If you have an allergy, have an EpiPen. And these are all things to talk about with your doctor. Oxygen monitors are sometimes a question that I get in general for respiratory illnesses. You don't need one because a lot of times it can be confusing what the number means to you. If you have COPD, an okay number is actually a little lower. So that's something to talk about with your doctor as well. I just wanted to give you guys a general overview, at least, of what vaccines we want people to get right now, what vaccines I support. COVID and flu and respiratory illnesses in general happen more during the winter time. A lot of times they don't even like become available until later. So you want to be able to get the COVID vaccine, respiratory illness like vaccines earlier. And those are just the ones that are kind of the most serious. Shingles is, if you're like really worried about it, there's no harm in getting that one first. That's an important vaccine to get that is very like overlooked. But because COVID is still going around, still an issue, I would say to prioritize COVID and flu.